Today, we're diving into how to differentiate between various types of pain. Understanding the source of your pain can help you seek the right treatment. Different types of pain can point to different underlying causes. By recognizing the characteristics of various pain types, you can seek the most effective treatment. Let's break down these different pain types, shall we? Let's start with soft tissue pain. Think of muscles, tendons, ligaments and fascia, those unsung heroes that allow us to move. When these tissues experience trauma or strain, they can become inflamed, leading to pain. Soft tissue pain is often described as a dull, aching or throbbing sensation. It's typically localized to the specific area where the muscle or connective tissue is affected. Movement, stretching or direct pressure can worsen the pain. Common examples include muscle strains, tendonitis and sprains. These conditions usually respond well to rest, ice, compression and elevation, the trusty RICE protocol. Hands-on manual therapy like massage can also be very helpful, as well as physiotherapies like deep tissue laser to reduce swelling, inflammation and pain. Now let's shift to joint pain. Joints connect our bones, allowing for a wide range of motion. When injured or inflamed, they can cause significant discomfort. Joint pain often presents as a deep, nagging ache in or around the joint. Movement is a key trigger for joint pain, causing pain and stiffness. Joint pain can be caused by osteoarthritis, joint subluxations, ligament injuries, and joint instability. Understanding the underlying cause is essential for effective treatment. Think about the difficulty of walking with an arthritic hip or gripping an object with an arthritic hand. Joint stabilization through physical therapy, as well as restoring proper joint mechanics through chiropractic adjustments, may help a great deal with joint pain. Let's move on to disc pain, a common source of back pain. The discs in our spine act as shock absorbers between the vertebrae. Disc pain is typically described as a deep, dull or aching pain in the back or neck. It can radiate to other areas like sciatica from a herniated disc. Certain movements like bending or lifting can exacerbate disc pain. Prolonged sitting can also trigger pain. Conditions like disc herniation and degenerative disc disease are common causes. The pain can range from mild to debilitating, often limiting daily activities. The appropriate treatment for a disc injury can vary depending upon the type and location of the injury. Sometimes physical therapy, chiropractic adjustments, traction and non-invasive measures can be quite helpful. But sometimes it is not enough and medical pain management interventions are necessary. And if those fail, surgery may be the only option to prevent long-term disability. Finally, let's discuss nerve pain, often described as sharp, shooting, burning or tingling. Nerves transmit signals throughout the body, and when compressed or damaged, they cause pain. Nerve pain often radiates along the path of the affected nerve. It can also cause sensations like numbness, tingling, or a pins and needles feeling. Conditions like herniated discs, spinal stenosis, and peripheral neuropathy can cause nerve pain. These unusual sensations are a telltale sign that a nerve is involved. Treatment for nerve pain can be very similar to treatments for disc injuries. Quite often, a referral to a board-certified neurologist to receive nerve conduction velocity and EMG testing will help determine the seriousness of the condition. This will tell the patient if they're objectively getting weaker. We've covered the different characteristics of soft tissue, joint disc, and nerve pain. Understanding these distinctions can help you communicate your symptoms to a healthcare professional. If your pain is persistent or affects daily activities, contact Bethesda Spine and Posture today for a diagnosis and treatment plan.